Hi there, I'm State Representative Justin Chenette.
And I'm Senator Linda Valentino, and we're here today bringing another session of Bringing Augusta to You.
Lots happened this week and still going on. I just want to mention state of the college education, basically the entire system, both community colleges, Maine Maritime Academy, and the UMaine system. All the presidents came before us in a joint session of the legislature and basically outlined where they're at. A nice snapshot of the colleges. The new community college system president was there, the one that took over for John Fitzsimmons, who was kind of forced out from the governor. And so really the synopsis of what they were really articulating was too much administration. They want to reduce the amount of administration in the UMaine system. They have outdated facilities. They want to improve that. And then obviously the cost of college. I mean, that was something that was echoed throughout all of the speeches. Obviously the community colleges are one of the cheapest in New England, which was a nice tidbit, but especially with the UMaine system, they're wanting to drive down cost. And that's something that we're trying to address with a number of bills, including an Opportunity Maine expansion that we'll get to in a little bit.
Yeah, well, and we had an extremely busy week in appropriations, and actually we're upstairs meeting now. We just jumped out for a few minutes. The theme on Monday was basically primary care is not a substitute for preventative care. And we've had overflow rooms every single day. We didn't get out until 8:30 one night.
You can't find parking.
Yeah. I mean, it's just been incredible the amount of people that have come out in opposition to certain parts of the budget. And what happened on Tuesday, or rather on Monday, was basically the transfer of $20 million out of the Fund for Healthy Maine. And that was supposed to go to maintaining the payments to the primary care providers. And I will tell you, I was very shocked because we had so many primary care providers come up to testify in opposition to that. And what many of the people said, like one doctor here, Dr. Dan Onion, said, to cut such programs to fund primary care makes no sense. And it is like robbing Peter to pay Paul, or really killing Peter to pay Paul. And these primary care doctors basically said that it was offering a false choice, that primary care was not a substitute for the preventative care. And what was really amazing is how many students came up.
Lots
because
of students, yeah.
What happened is really the Healthy Maine partnerships in the schools. These students came up and said how valuable these health resources were in the schools. Tobacco prevention, obesity counseling, depression, and one after the other said that they really had no resources at home, and that these were a vital resource for them.
And if you cut that funding, those programs go away, and you might see an increase, a dramatic increase in the amount of tobacco use and substance abuse in our teenagers.
And one of the things is that it was not an either or. We can fund both of them, and there's no need to make those reductions.
Right. And moving on, we also testified before the Transportation Committee. You used to be a member of it.
Yeah.
And so our entire delegation was there along with Headmaster Rainey Menard of Thornton Academy. And it was for our sign bill. It's to put 2 directional signs on the interstate, directing individuals, the thousands of people that come to the campus every year, not just the students that utilize it, but you have over 160 international students and their families. You have the big athletic events and different things from not just the state, but other states as well. So it's really important that we try to get this passed. We testified before the committee, and we'll find out very shortly.
Yeah, and Senator Hobbins came, and he testified. So all 3 of the delegation were all graduates of Thornton Academy. We were there, and in addition, Representative George Hogan came up, and he testified. So it was
strong
a
showing of support.
really strong showing of support. Coming back to appropriations on Tuesday, this is when we had the reductions to the general assistance. We had a lot of people up opposing the cuts to the general assistance. The biggest thing is that it would be a shift onto the property taxes again, and there's so many things in this budget that are being shifted onto the property taxes. I think the most interesting part, though, of the hearing was one of the parts that the administration has said that they were going to be cutting the benefits to legal non-citizens. We had many, many asylum seekers that were here, and I give them a lot of credit. Not one person on that list left. You do a sign-up sheet, and usually people by 5 o'clock, 6 o'clock, 7 o'clock, they just pass in their testimony and go home. They didn't. They stayed until 8:30 until every single person was heard. And these people are very high professional people. Most of the asylum seekers that are actually coming to the United States are educated people, because those are the ones that speak out against the opposition in their country. And we had a judge that came before us, spoke in French with an interpreter, that when they came to get him, he wasn't home. They raped his wife, they raped his 2 daughters, they beat up his son, and it was all because they had told the judge that he had to convict an innocent man. And these people are engineers, doctors, lawyers. They are highly, highly educated people. And what they're saying is that our government is preventing them from working the 6 months while they're here, and they have no other outlet. So it was very compelling testimony.
Over in my committee in criminal justice, we continue the streak of unanimous bills. I mean, I can't get over it. This is sort of unprecedented for our committee. I think we have 7 in a row that are unanimous bills supported by both sides of the aisle. And the one that we just passed this week regarding the blue alert system, which basically notifies the entire state of all the police officers, all of our law enforcement officials, if a law enforcement official is shot, if they're wounded, if they're injured, if they're killed, it goes out as an alert to notify all other police and law enforcement officers to help protect. If this individual is on the loose in a particular county, they can be notifying that particular county sheriff office. So this is a really something that we can come together on, and we actually demonstrated it in committee by passing it unanimously. So this is part of a national movement to support our police officers and law enforcement, and it kind of reminds me of our Blue Light Project we're doing back in
Exactly. I was going to mention your Blue Light Project.
Yeah.
That's great. And wrapping it up yesterday in appropriations, we had so many senior citizens come before us because of the reductions in the drugs for the elderly account.
Right.
And these senior citizens testified one after the other that they don't need a double homestead exemption. They're living in senior citizen housing right now. The property tax is really not affecting them, but what affects them is the prescription drugs. And these people are paying anywhere, if they had to pay themselves $3,000 to $10,000 to $85,000
Ridiculous.
a month
Yeah.
for some of their prescription drugs. And even though that they can get a Medigap insurance policy, that again would add for an elderly couple over $400 a month to their budget, and they don't have that money.
Right.
So it was very heartbreaking to see so many elderly people that could not afford it be faced with this decision on the prescription drugs. So obviously we're going to be helping them with that too.
Exactly. And my mom even testified before your committee regarding methadone, so that was
Yes,
something we
and
can
your
talk
mother
about.
was up today, and so we both have a lot to get back to
Yes.
on our committees, but we just wanted to give you this quick update today.
All right, we'll see you right back here next week.
Thank you very much.